Welcome to Weiner Wellness Week, Spring Fling edition, even though it feels like summertime is already upon us, right? Beautiful day outside. Thank you everybody for joining us today. Anybody here new for the first time? Anybody new? Okay, so hardcore veterans, as always, right? Just to let you know, our next event, our next Weiner Wellness Week, so you can put it in your calendar, will be July 18th through the 25th. So, roughly around 2 months away. So keep that in mind, factor that into your equations. So most of you know who I am, but I'll just introduce myself one more time. My name is Mike Gallagher. I am a certified lifestyle educator. I've been in the nutrition industry for almost 20 years. And, I'm here to help you out, answer any questions during these events. And, of course, we're talking today on a very health issue that's prominent this time of year, allergies, allergy season. But you can ask me any questions about any condition, and if I don't know the answer, I'll try my best to find it for you. So we're here to help you in any way, shape, or form, okay? So let's talk about allergies. This is the only downfall for some individuals when it gets warmer. The flowers start blooming. This, for some individuals, this can be a pretty rough time of year, allergy season. In fact, I heard in the news this week that they are using the phrase pollen tsunami. Pollen tsunami. Did anybody else hear that phrase? Yeah, that's how bad the pollen is right now. Pollen tsunami. So this is, unfortunately for some, can be a very rough time for those individuals. So if we look at it statistically, 50 million people suffer from some type of allergy, 1 in 5 this time of year. So if you have allergies, you're not alone. However, if we include sensitivities, including food, chemical, environmental, this number is way higher, way higher. I would estimate at least 3 out of 5 people, if not 4 out of 5 people, have some type of sensitivity issue going on this time of year, okay? So this is a major issue. And just a little background on this, the allergy basically is an immune reaction to something your body perceives as a foreign invader, okay? It then mounts a defense against this invader, and it starts this whole process of inflammation, this chemical process that creates these allergy symptoms, okay? And of course, it can affect every single one of your major organ systems, but usually nose, mouth, skin, throat, stomach are at the forefront with these type of issues. All right, so we know then, of course, it leads to the multitude of symptoms that we know as seasonal issues. Itchiness, redness, swelling, discharge, wheezing, hives, stomach issues, difficulty swallowing, breathing. You get the drift. If you've had these, you know what I'm talking about, right? So this is a major, major health problem going on. Now, this is where we really get into the science of allergies, okay? So there's actually 2 different types of allergies. There's your first type, which is called IgE, okay? This is an antibody, which is a protein found in your immune system, okay, that starts or produces this immediate hypersensitivity reaction, okay? This is known as classic seasonal allergy issues. Then we get into other antibodies like IgG and IgA, and these produce what's called delayed hypersensitivity reactions. And this is really where food comes into play, okay? So the number one food for anybody with any type of seasonal allergy is dairy, okay? So everybody knows what milk is, but let's break it all down. Besides dairy, besides milk, cheese, pizza, ice cream, yogurt, cottage cheese, and regular commercial butter. These particular foods, especially for any sinus or lung issue, is actually triggering your allergies. There's actually the reason why you're feeling this way. So I always tell somebody who has seasonal allergies to avoid all dairy for a week, 7 days. Avoid it all, okay? Usually 7 days is enough time for someone to feel it, to notice a difference. And after 7 days, I tell them, give me 7 more days. Give me another week. Hopefully now you feel better. It keeps you motivated to stick with it. And then I say, give me another week. 7 more days. Why do I say it that way? Because it takes 21 days to get these foods out of your system to avoid these type of delayed hypersensitivity issues. Okay? So for a lot of people, 21 days is 21 years. But most people can handle a week at a time. And a week is enough time to really start feeling better, to not have these sinus issues. And again, hopefully that keeps you motivated and sticks with it, right? So in our allergy solution brochures, which we have extra copies of, I just go right, if you open it up, I just go right to the milk and dairy substitutes. It's right there printed. I say, focus on the yes. Let's not dwell on the no. Give me a week. I strongly urge you to give me a week avoiding all dairy, and you will see tremendous benefits from sinus and lung issues for allergy season. Okay? Yeah, well, you can sit up here, folks. We have plenty of room. No need.
Thank you.
Absolutely. Here you go.
Thank you.
Here's the handouts. Okay? All right, so does that make sense to everybody, right? This is where food can be your enemy. This really when it comes to these allergy issues. Okay, so here's the biochemistry of it. So that IgE, causing that immediate hypersensitivity, travels to the blood and binds to the basophils and mast cells, which are in your immune system, which then release those chemical messengers, histamine, prostaglandin, and leukotrienes. Okay? They basically overproduce them, which causes these type of inflammatory issues, okay, that we know as seasonal allergies. So this is, most people understand this, already know this, or in some capacity. I think most of us learned this in grade school science class in some capacity. But what is often overlooked when it comes to allergies is the role that free radical damage has, oxidative stress has on allergies and all inflammation, but especially allergies. So for us, there's 2 pieces to the puzzle, so to speak, for allergies. Airmax and rad-free. Okay? Rad-free, especially of the more serious allergy issues like asthma, COPD, emphysema, bronchitis, pneumonia. The rad-free will really help give you additional support with these type of issues as well. Okay? So, let's talk about the Airmax. Okay, so I brought a bottle here, which I forgot to open. So let me open this up real quick. Thought there's something I forgot. So we're sampling this in the back, but if you've never tried this before, I would ask you to try 2 of these, okay? Take 2 of these if you have any allergies or sensitivities. I don't say to use the word allergies anymore because so many people have this definition of what it means, allergy, and they say, oh no, that's not me. Okay, so I don't use that word. I actually say sensitivities, which tend to flare up this time of year. And I've sampled this thousands of times, okay? And it's funny, when I'm talking to a doctor for the first time about this, so 2 for adults, unless you're under 100 pounds or under 12, or you say you're very sensitive to vitamins or medications, then just take 1. Okay, then just take 1. So there's very, very, very few supplements in the 20 years, if any, that work as quickly as this particular supplement, okay? This works usually in 15 minutes or less, usually 5 minutes. Some cases people have noticed it works in 30 seconds. 30 seconds for allergies and sensitivities, okay? Anywhere you would use Benadryl or Claritin or Allegra, you can use the Air Max for, okay? I always tell people this is the fastest natural antihistamine on the market, okay? The fastest. Yes?
What happens if you live in the woods? We have a lot of flowers and a lot of trees and a lot of people that are cutting the grass around their houses
Yeah.
in my neighborhood.
Yep.
You can't just, I don't have air conditioning.
Mm-hmm.
So I open windows at night for the cool air to come in.
Right.
I mean, if I'm just taking these pills and I'm still, my air quality is what it is.
Right. So this actually will give you immediate relief. It lasts for about 4 to 6 hours in duration, so you can take it as needed. But at the end of the talk, we're going to share with you the next step. Why you're actually having allergies in the first place, how we can really get to the root of the problem so you don't have to keep taking Air Max for the rest of your life. So I will definitely answer that question for you at the end of the talk. Okay? So first we're just breaking this down. And again, if please encourage you to try it if you've never tried this before with this. It works very, very fast. Okay? So we have some more up here. We have some more in the back for you to try. So any seasonal allergy, of course, this will be excellent for. And it's as needed basis, right? So if you mow the lawn, you break out before you mow the lawn, take this before you mow the lawn. If you have cat allergies, dog allergies, you know, you're going to see relatives that have those animals in their house, take this before you go, okay? No side effects, no drowsiness, nothing. So this is one of the rare supplements that works faster than the drugs with no side effects whatsoever, okay? 5 to 10 minutes for most people to notice this, lasts 4 to 6 hours in duration, okay? Also, folks, keep in mind skin issues, poison ivy, poison oak, hives, even mosquito bites are technically allergic reactions. So where there's a lot of itchiness going on, you can use Air Max for, okay? I've also had people use this for snoring. People who snore, take 2 of these before they go to bed. It opens up the airways. Yeah, so that's another little side benefit of this as well. Mm-hmm. Yes?
Can you use this, first of all, why does it work so fast? And can you use this since there's so much C? Can you use this as your vitamin C supplement? Or can you take too much of it?
Can you take too much of this? Well,
Like say if you're taking a lot of C, like, you know, like 10 a day.
I would back down on the C and replace it with this.
You can use this like your C to.
Yeah, you know, and you don't need to take this much if you're using this properly, and we'll talk about the dose. Why it works so fast, folks? Because it's a chewable. It gets into your saliva, gets into your blood much, much quicker than a pill, okay? That's why this is so unique in a chewable delivery system. It works this fast, okay? Now, skin issues, as I mentioned, I've had doctors who had poison ivy, full body itch, took 2 of these, the itch went completely gone, completely away, okay? So anywhere you would use Benadryl or Claritin or any histamine blocker, you can use Air Max for, okay? So it has multiple roles. Now what's in it? There's your vitamin C, quercetin, bromelain, DMG, Perilla seed extract, which is from the polyphenol class, which breaks down to rosmarinic acid and luteolin. These are all in the chewables. We do have a pill option. In the pills, we have a little bit more wiggle room. We added 2 additional ingredients, grapeseed extract and N-acetylcysteine. Every one of these ingredients has research to lower IgE and histamine, and a lot of companies sell these, supplement companies sell these individually or use some variations of these products with their allergy formulas. But nobody in the industry right now has every one of these ingredients at this dosage, therapeutic dosage, in a chewable delivery system. And that is what really makes AirMax unique and different than things you go to any other place to get. Very, very, very unique. Okay, so let's break it down a little bit more in detail. So somebody said, well, what's the number one ingredient in AirMax? I would say quercetin. Quercetin, individual ingredient-wise, is the strongest natural antihistamine ingredient by itself. Okay? Bromelain and C also have research to lower histamine, but they on their own, but they also enhance the quercetin. Okay? They make the quercetin even that much more efficient and that much more absorbable. So I call this is a very unique synergism where multiple ingredients work better than individual ingredients by themselves. And I call this the triple stack attack right here. Okay? These three things working together in unison works better than just taking quercetin by itself. Here's a study for you folks. Again, this is what I show medical doctors who have never seen this study. Never. How do I know that? Because they told me. I've never seen a study. Okay? Quercetin, they did a study where they compared it to a drug called cromolyn, which is a mast cell stabilizer. And this study, which is very current, 2012, said that quercetin, was more effective than that pharmaceutical drug for reducing inflammation. Stronger than the drug, folks. Stronger. No side effects. Okay? Here's another study. High pollen count. Quercetin dramatically reduced people with high pollen issues. So very, very powerful. The second most important ingredient I would say on this formula is Perilla seed extract. Perilla seed, most people have never heard before, but even though it's been around for hundreds of years. Okay, it comes from the polyphenol class. Breaks down into those ingredients, rosmarinic acid and luteolin. Again, on its own, it's been shown to lower histamine, and it helps with all classic seasonal allergy issues. So here's a little bit more research on those two. So rosmarinic acid, again, lowers IgE, lowers histamine. Okay? Helps with rhinitis. Here's a study, helps with asthma. Luteolin, very powerful anti-inflammatory, anti-allergenic. Okay? So very current research, very current information and studies on these ingredients. Then last but not least, Dmg, dimethyl glycine. Okay? Dmg, I think, is one of the number one ingredients in the world. Okay? It's our secret sauce, so to speak. Dmg is the master methylator. It will enhance every single supplement or ingredient you combine it with. So it takes all those other ingredients that work by themselves on their own, and it takes it even to a higher level. So you get even greater absorbability on the nutrients. Okay? Dmg. Okay. Put it all together, you can see how this can be very effective and work very, very well. So as I mentioned at the beginning, when I was sampling this out, I take two chewables. I always tell people 15 minutes. Usually it's faster. Usually it's 5 to 10 minutes. Some cases, like I said, 30 seconds for some individuals. Again, unless you're under 100 pounds or under 12, or you say you're very sensitive to vitamins or medications, then just start with one chewable. Okay? The reason why I changed the verbiage on this from allergies to sensitivities is because I've sampled this supplement to literally hundreds of doctors, okay, and thousands of people. And the number one objection we get with this is that, I don't have any allergies, I don't need this, okay? So when I'm meeting with a doctor for the first time, and I ask him to try the AirMax, I say, here you go, doc. I brought you some sample for you to try. I'd like you to try it right now. And they go, I don't have any allergies. And I'm like, I know you don't. I just want you to taste it. And they taste it, okay? We get done doing the talk, the presentation, and they start saying, oh my God, I can breathe better. Oh my God, I feel better. Oh my God, my head is clear. The majority of doctors that I sample this to, and I'm like, doc, I'm confused. You told me you're totally fine. You told me you don't have any issues at all. But yet you notice this formula. It's working for you. And then the doc always had a little sly smile on his face. He's like, you got me, you got me, you got me. But this is the average person. So this isn't for the most severe allergy person in the world. This is for the everyday sensitivities, which this time of year flare up even greater because of the high pollen count, because what's in our environment, because of the air we're breathing is terrible. Okay? So this can help a tremendous amount of people. Okay? Tremendous amount of people that didn't think they had any problems until they took this. Until they took this. Okay. By the way, I've had some incredible cases with this since we debuted this a few years ago. There was a woman here from Johnstown, and she said she had horrible sinusitis, like terrible pain. Okay, I said, how long have you had this? She said, 20 years. How much is your pain? On a scale of 1 to 10, how much are you in pain? 10 being the worst. She said 8. Right now, usually it's a 9. I gave her 2 Air Max to try. I said, come see me in a few minutes. Come see me in 15 minutes. Wasn't even 15 minutes, like 5 minutes. 5 minutes. She said, oh my God. She came up to me, gave me a big hug. Oh my God, pain is gone. I can breathe. I've never been able to breathe in 20 years. Now I can breathe. 5 minutes, folks. 5 minutes with Air Max. Okay? I was doing another talk for a doctor at their place, at their clinic, on this. And I was passing around a sample of it. I said, please try it, just like I asked you guys to try it. And there was a woman there. You could tell she's very skeptical. She's like, how soon am I supposed to see results? I'm like, 15 minutes or less. Are you sure? And I'm like, yes. Really? Really? Okay. So she tried it, very reluctantly tried it. Oh my God, like it's poison, but she tried it. Okay. So we get started to talk, and she was right there in the middle, seating. And all of a sudden, I could see her start doing like this. And then she just screams out, oh my God, I can breathe. I haven't been able to breathe in years. Okay? So then everybody there started scrambling for the Air Max. They started diving. It was like a feeding frenzy of sharks. Everybody starts diving for it, right? So I wait for the dust to settle. Everybody gets back in their seats. I'm like, folks, what did we learn here? And they said, what? Never doubt me. Never. This works. This really works. It's that powerful. It's amazing. I've never seen a supplement in 20 years work this quickly, this fast for every single person that has these issues. Okay? Now, we do have a pill. We do have a pill. It's twice as strong. 1 pill equals 2 chewables. It just takes twice as long. Okay? It takes about 30 minutes. So if you don't want to do chewables, if you prefer pills, we do have the pill option. Just keep that in mind. It does take a little bit longer to get in your system. Okay? Now, when we get into the more serious upper respiratory issues like asthma, COPD, emphysema, bronchitis, pneumonia, okay? This is a more serious issue, so we have to be more serious taking the Air Max. We want to be more aggressive. So on the Air Max with the chewables, we want to bump it up to 6 a day. 2 breakfast, 2 lunch, 2 dinner. If you're doing the pills, 1, 1, and 1. Okay? For asthmatics, if we add the rat-free, which I'll talk about next, with the Air Max, get off the dairy, we have helped hundreds and hundreds and hundreds of people with asthma within a month or 2 do not have asthma. Okay? Hundreds and hundreds of asthmatics. Okay? And at the very least, I would tell an asthmatic, at the very least, you're going to be able to reduce your everyday corticosteroid, which you hate taking. Well, I know you do. Okay? At the very most, we're going to get you off it completely, and all they carry is their inhaler just for emergency situations only, which I totally understand, right? But this does work, folks. So, again, maybe not you, but maybe you know a friend, family member who has asthma. This will absolutely work. Air Max, rat-free, get off the dairy. Get off the dairy. Yes. Get all dairy. All dairy. So milk. What's that?
Eggs also?
I wouldn't classify eggs as dairy, right? So milk, cheese, yogurt, pizza, ice cream, cottage cheese, regular commercial butter. Go organic grass-fed butter, right? So all that is in that brochure right there for you. Yeah, 21 days it takes to get those foods out of your system. Those are the triggers usually for these type of issues. One little side note that I just want to mention, Dr. Weiner talks a lot about X-Flame on the radio. Okay, we use that more for acute pain issues. Okay, however, it does have some of these same ingredients that are in the Air Max and Rad Free, so it will help with your allergies and upper respiratories as well. It has dual purposes. So if you have acute pain issues, X-Flame and asthma or allergies, X-Flame would actually help with both. So it has, you know, multiple benefits, multiple purposes. So just want to let you know about that. Any other questions on Air Max before we move on? Okay. Yes.
A friend of mine has been asthmatic for years. He had been using his inhalers.
Yes.
And for years and years and years, and he was doing a heavy dose of lifting at work.
Yeah.
He got out of his car. He was fine. He got out of his car and started walking into the office, and his leg broke in 2 pieces.
Yes.
And it destroys your bones.
It does. That's right. It actually causes osteopenia, osteoporosis, causes candida fungal issues. It causes all kinds of problems in your GI tract.
That's the other thing that he does have, for sure.
Yeah. So again, we want to get off those corticosteroids. Those are only meant to be taken short-term, never long-term situations. So yeah, share this with him, right? Share this so we can help him. Yes. No, Inflame has different ingredients than the X-Flame. So X-Flame would be more for allergies and upper respiratory issues versus the Inflame. But great question. Okay, that's number one. Number two, again, as I mentioned at the beginning, there is a free radical association, oxidative stress association with allergies. This is often overlooked or not understood at all, okay, the connection between allergies and free radical damage. So basically, in a nutshell, right, when we talk about free radicals, this is basically rust on your cells, right? This is part of the aging process, how we age, right? And everybody has a different, it affects everybody a little bit different organ system, okay? But this particular formula, rad-free, is specific for, has many different benefits and purposes, but these are where we position this one for these type of oxidative stress issues, rad-free. So allergies, of course, what we're talking about today, but good for your immune, good for energy, good for your skin, again, anti-aging benefits. Bruising, if you bruise excessively, okay, or post-surgery, this will really help with bruising. That's usually free radical oxidative stress issue. Chronic nosebleeds. Chronic nosebleeds, if you have them or someone you know, just using the rad-free, usually it's a capillary issue. Within a day or two, those nosebleeds will be gone. I've seen it happen many times for individuals with this, just using the rad-free. And it's also really good for the heart, okay? Really good for the heart. But let's go back to the capillary issues here, capillary integrity. So just getting off the allergy here for a second, let's talk about the veins. Capillary integrity. So hemorrhoids, varicose veins, spider veins, okay? These are usually free radical association here, oxidative stress association here. So if we use the rad-free with one of our other formulas, a tincture, our tincture called Circular Extremities, okay? So we're doing the dosage we would recommend for these issues, veins, vein issues, is 2 and 2. 2 rad-free in the morning and 2 droppers full of the extremities. Put it in a glass of water to your juice because it is alcohol-based, unless you can handle the alcohol, right? So if you want a little shot of whiskey in the morning, by all means, that's it. But then 2 in the morning and 2 in the evening. So 2 and 2 of both, morning and evening, okay? If you have hemorrhoids, pain will be gone in a day. In a day. I've seen this hundreds of times. hundreds of times. I know this for certainty. Every single person that we recommended this for hemorrhoids, the pain is gone in a day if you do 2 and 2 of each of these. The hemorrhoid itself will be usually gone within 30 days, both outer and inner hemorrhoids. Okay? Varicose veins, I always tell someone, listen, you didn't get varicose veins overnight. You got to give us a little bit of time here. I always tell someone with varicose veins 3 months. But every day, if you're consistent taking these 2 things, those veins will get smaller and smaller and smaller and smaller and smaller and less visible. Okay? Spider veins, obviously the vein is a lot less. 30 days. 30 days for spider veins. Okay? So now it's getting warmer out. I know that's a big concern for a lot of women especially, right? So this would be what we would recommend for spider veins. Now, as you can imagine, I do this talk for a lot of female doctors and female staff. And I have had many of them challenge me on this for the spider veins, okay, for the varicose veins and spider veins. And I come back, I see them a month or 2 later. They say, Mike, we're going to hold you to it. You say this works, we're going to trust you. I'm like, yes, it will work if you take it consistently. I guarantee it. I promise you. So I come back a month or 2 later to see them. How are the veins? How are you doing? Right? And the majority of the females say, Mike, it really works. I can't believe it. Okay? But occasionally I hear, someone will say to me, Mike, I didn't think it was working until my husband or children said, wow, Mom, your veins are getting smaller. So it's kind of like when you see yourself every day, you don't notice those subtle changes. But when you see yourself, someone sees you sporadically or weekly or occasionally, they're the ones who notice the veins. So if you're going to challenge me on this, if you're going to try this, we suggest for the veins, you take a picture. Take a picture of your veins before you start, and then take a picture 30 days later. Okay? And let's compare. It does work, folks. It does work. I'm extremely confident that it will help with all these vein issues. Okay? So, normal price on this, rat-free, you're doing 2 and 2. So basically you're doing 2 bottles of the rat-free for 30 days. In that 30-day period, 2 bottles of the tincture in that 30-day period. Normal price, it's about $60. Okay, obviously it's discounted today on special. Okay, so that's 2 bottles, 1 bottle of each, around $60. And you need 2 bottles. So normally it's $120. It's discounted off of that. Okay, so you can go to a vein clinic, and it costs about $2,000, and it's extremely painful for your veins, extremely painful. Or you can try our program for $100. $2,000, $100, painful, no pain, what will you do? So, just keep that in mind. But it does really work, okay? So, another way you can use this. Now, what's in the rat-free that makes this so unique? There's 2 main ingredients here. Activin, which is the most researched grapeseed extract on the market, and bioflavonoids. Those are the first 2. Those are the main 2. It has a little bit of resveratrol, quercetin, and glutathione, but the first 2 are the main ingredients here. So, as I said earlier, the way we dose this, we always start more aggressive. 2 and 2. 2 in the morning, 2 at night. Once the condition is under control, then we start backing down on the dosage, down to 2 a day for a bottle. If everything is still good, then we back it down to 1 a day for a bottle. So 4, 2, 1. Okay, could you do it every day for your life? Yeah, you could do this every day. Has amazing properties to it as far as prevention. Okay, so this first ingredient, Activin, which is, again, first ingredient in rat-free. Activin is the most researched grapeseed extract, okay? Grapeseed extract, we talk, folks, about a lot of different supplements, a lot of different ingredients, and there's some amazing vitamins and nutrients that are out there. But I would say grapeseed extract, I would put that at the top of the list. I would put it top 5 of all supplements of all time. It's that powerful, grapeseed extract. And there's 100 published studies on grapeseed extract, and Activin has 90 of them. So when we say this is the most researched grapeseed extract, we're not joking. It really is. And that's why we're using this particular source. So, of course, it has antioxidant properties to it. It's chemoprotective, so for cancer patients or people who have cancer. Antimicrobial, anti-inflammatory. On a DNA level, it helps protect the DNA. So again, anti-aging benefits and properties to it. When you compare it on a free radical test to your vitamins, vitamin C, vitamin E, and A, it blows it away on a free radical level. And I'll show you that here in a moment. Okay? For your smokers, it will inhibit the damage caused by the tobacco. Okay, so if I'm having a conversation with a smoker, I always say to them, Mrs. Smith, you're obviously not ready to quit yet. We'd like you to quit, but you're not ready yet. However, I have something here that can actually inhibit the damage caused not only on your lungs, but on every cell in your body. It can inhibit that. Is that something that interests you? And if there's any interest, they usually say, how much? How much we talking? I say, well, it's about $20. 2 capsules a day for smokers. $5 a week. Oh, by the way, how much is your pack of cigs? How many packs a week do you smoke? I was getting gas the other day, gas station, person in front of me bought a pack of Marlboro Lights, $7.60. Marlboro Lights, 1 pack. So, Mrs. Smith, I'm asking you to take something that's going to help prevent the damage caused, not only on your lungs, but on every cell in your body. You're taking something that's going to kill you. I'm asking you to take something that's going to help you for $5 a week. Can you meet me halfway? Some will, some won't, but we try. That's all we can do for smokers, right? That's all we can do. Same thing with your people who continuously take acetaminophen, Tylenol, and the NSAIDs. People should not be taking these for more than 3 days in a row. We heard numerous studies, we talk about it all the time, that after 3 days, these can cause serious damage on your kidneys and your liver and cause intestinal bleeding and all kinds of problems. But if people keep taking their Tylenol and they don't want to try anything natural, I'd say again, can you meet me halfway? We have something that's going to help protect the liver and the kidneys, even though the Tylenol is causing major harm. It does have detox properties to it as well. All right, so let's do a little test here, comparing it to the free radicals. This is a free radical scavenger activity test. At 50 milligrams, vitamin E has been shown between 84 and 98% greater than vitamin E. At 100 milligrams, it's been shown between 439 and 575% greater than vitamin C. Per capsule of a rat-free, you're getting 60 milligrams. So when we want you to do 4 capsules for asthma, for hemorrhoids, for veins, we're hitting you with over 2,000% greater than the common vitamins. We're really being super aggressive to fight that rust on your cells. That's why this works, folks. Super aggressive. Is vitamin C important? Yes, but this is way stronger than vitamin C. Yep.
Is that vitamin C in there, or is that some other supplement, some other kind of substance?
Rat-free does not have vitamin C. The Air Max had vitamin C.
What is it that you
Grapeseed extract. This is grapeseed extract.
The Activin's all grapeseed extract?
No, Activin, there's only one source. We have to purchase this raw material. That's that R with the circle around it. Not all grapeseed extract has these studies. Only this one that we're using in the rat-free. Yeah, not all grapeseed can make these claims. This one can. Okay, that's why we can say this. But that's how powerful grapeseed extract is, folks, on a free radical test. Now, the second main ingredient, bioflavonoids. Bioflavonoids are from the pigment in the fruits and plants in your citrus. It has a lot of the same properties as grapeseed extract as well. But let's go back to the allergies. And again, why we recommend this with allergies is there's tremendous research. Again, lowers IgE, lowers IgG, those antibodies that we first talked about. Helps lower the incidence of asthma and anaphylactics. Okay? So it literally opens up the airways. Opens up the airways. So that's why we recommend this for asthmatics and COPD, emphysema, bronchitis, pneumonia. And get off the dairy. So the AirMax is going to give you immediate quick results. The rat-free has these other nutrients that's going to keep those airways open. And you get off the dairy, it produces a very powerful effect. And that's why we've helped thousands of people with these issues. Okay, it has a little bit of resveratrol. Just want to mention this briefly. Resveratrol made headlines a few years ago as anti-aging. But there are also some great properties to resveratrol that people might not be aware of, that it helps also with asthma and allergies as well. Okay, so we do have it by itself in a stronger version on that. Okay, here is the key takeaway. The whole point of this, folks, is we don't want you to keep taking AirMax for the rest of your life. AirMax is a temporary Band-Aid. Right? I know you don't want to keep taking AirMax the rest of your life either, okay? So to get to the root of the problem, it's usually one of two things for anybody with a seasonal allergy. You either have GI stomach problems, which we call a leaky gut, which is why your body perceives things as a foreign invader and overproduces those histamine and prostaglandins that we talked about. Or you have an adrenal issue. An adrenal issue. Okay? So I always ask somebody, have you had any stomach problems in the last 60 days? Or how is your energy level? Are you tired during the day, but yet you're having trouble sleeping at night? And that's classic adrenal fatigue. Okay? So if you have stomach issues, then that's where our GI Complete would come in. Okay, this will fix the stomach. This will fix the problem. So within 1 to 2 bottles, guess what? You won't have any more allergies. Your allergies will be greatly reduced, if not completely gone, within 1 to 2 months. Okay, that's our GI program. And we have brochures in the back. You can come see me. When we're done here, I'll go over that with you in more detail. If you have adrenal issues, again, if you're tired all day long, but then when it's time to go to bed and then you're up and you can't go to sleep, that is adrenal fatigue. And that's where our Adrenamax would come into play. Our Adrenamax. Again, if you try this, those allergies will be greatly diminished, if not completely gone, within 1 to 2 months. Okay? Lastly, if you try the AirMax, which is why I encouraged everybody here to taste it and try it, and you say you have seasonal allergies, and you taste the AirMax and you don't notice one single difference, that it's not working for you at all, zip, zero, zilch, you do not have seasonal allergies, folks. You actually have a candida fungal issue that flares up during allergy season, but you actually have candida fungal issue. Okay? And by the way, folks, if you're a female, you're not alone. 3 out of 4 females have candida fungal issues right now. If you're a man, 1 out of 2 men have candida fungal issues right now. So, if you try the AirMax and you don't notice anything at all, then this is the answer right here, our Candida program. Candy Kill, which is the most powerful Candida formula on the market. Took us 2 years to develop this. You do 3 with breakfast. And then the SBC, which is like a vacuum cleaner, it sucks up the Candida like a vacuum, minimizes die if you do this 3 in the evening. Okay, and just 1 bottle of taking this and following our Candida program will have incredible results. And especially this is true for people who say they have chronic sinusitis, chronic sinus issues. Okay? You don't have allergies. So that's why the importance of tasting the Air Max, seeing if it works for you, because now we know what the next step is. We can tell within 5 to 10 minutes whether it's a candida issue or really, if it is an allergy, then the next step, either doing a GI program or adrenal program to fix the problem, to fix it at its root. So Air Max is one of the most unique things because it can give us the direction of what the next step is. And that is really fixing the problem. Okay, does that make sense to everybody? Okay, so please pass that on to people who couldn't make it today. Again, there's many studies, published references here that I listed and gave you all handouts on, gave you the text sheets on each of the formulas. Again, the brochure, right, spells it all out. Avoid the dairy. Milk does not do your body good. Milk does your body bad. Okay? So, there it is right there, folks. Any questions at all? Yes. Yes, it will. You'll have leaky gut. 1 scoop in the morning, 1 scoop in the evening, along with the superbiotic.
What if you're taking, like, when I look at this, I'm taking, now, I drink Gallagher, I take L-glutamine, I take Dmg Dimethyl.
Well, those are all excellent, but that has 7 other things in there. That has 10 different ingredients in all of them. Yeah, and over time, we would transition to taking those individually into combining it into that one formula, right? So you can still finish your bottle, but after you're done, we would transition to just taking a GI Complete to make it a lot simpler and easier for you.
This doesn't have probiotics.
That does not have probiotics, so that's why we'd add the superbiotics to the program. So those are the 2 things for GI. Okay? All right, folks, my time is up. Thank you so much. I did make extra copies, so if you have anybody here who couldn't make it, family, friends, neighbors who have these type of issues, please take this brochure home with them and tell them what we talked about, because we can really change their life. Okay? I'll be in the back to answer any other questions. Thank you. Have a great day.